Welcome to the Affirming Minds podcast, where we equip like-minded mental health professionals with a therapeutic toolkit that helps add to a more engaging, fulfilled, and effective mental health practice. Each empowering episode can stand alone as a continuing education pod course or a very valuable professional or personal resource with insightful expert interviews, practical resources, industry news, and lots of inspiration. We help the modern therapist thrive at work. Now let's welcome your host, a dedicated therapist and passionate educator, Shaina Siber, LCSW.
Welcome to the Affirming Minds podcast. I'm your host, Shaina Siber. I'm so happy that you tuned in today. This show is for educational purposes only and is not a substitute for professional treatment or clinical supervision. If you're in need of support, please reach out to a licensed mental health professional in your area. All clinical examples shared are fully de-identified composites or vignettes. No real client information is ever disclosed. If you're interested in earning continuing education credits for this episode, head to AFFIRMmentalhealth.com. Our membership gives you access to CEs for live virtual workshops, self-study webinars, and eligible podcast episodes right here on the Affirming Minds podcast. Today, we're exploring something nearly everyone can relate to: sleep, or the lack of it. We're living through what many describe as a modern sleep crisis. And while most of us know the basics of sleep hygiene, very few of us truly understand what's happening in our bodies and minds when rest doesn't come. This episode moves well beyond surface level sleep tips. We're exploring the deeper biological and psychological patterns that keep us awake. And I have to say, this conversation completely changed how I think about sleep. We discuss why so many of us find ourselves tired, but also wired, what's happening in the nervous system when rest feels impossible, and how we begin to restore harmony with the body's natural rhythm. My guest today is Dr. Shaina Silverman, a Stanford-trained sleep psychologist and insomnia expert who's passionate about helping women get to the root cause of their sleep challenges. She uses a personalized, mindfulness-based approach to help people improve sleep naturally, without medication, and she's an expert in cognitive behavioral therapy for insomnia, or CBT-I, the gold standard first-line treatment for chronic insomnia. Dr. Silverman's research has been published in Sleep Health, Journal of the National Sleep Foundation, and she regularly provides expert commentary on sleep, stress, and women's health across major media platforms. She believes that quality sleep isn't a luxury, it's about a basic human need, and her mission is to make science-backed sleep information accessible to everyone. In this episode, we'll unpack what's fueling the modern sleep crisis, how to work with your body's rhythms instead of against them, and how clinicians can use evidence-based strategies to support both their clients and themselves in getting better rest. So let's dive into why we can't sleep. Sarah, thank you so much for being here today and joining us on the Affirming Minds podcast. It's so great to have you.
Thank you so much for having me, Shaina. I'm very excited to chat with you today about sleep health.
Yeah, we were talking a little bit about offline. I think this is one of those issues where it has touched the clients I work with at every phase of my career. I'm never not working with at least some of the people that I'm working with that are struggling with sleep. And I have also had chronic sleep issues my whole life. And it's one of those things you're trying to want to model for clients. But sometimes it definitely gets into that do as I say, not as I do. The sleep health and hygiene can be really tricky. So I'm super interested to get your insight today. So with that, can you introduce yourself and share how you became interested in studying and working with sleep?
Sure. So my name is Dr. Shaina Silverman, and I am a clinical health psychologist with a specialty in sleep psychology, or also called behavioral sleep medicine. And basically, I help people sleep more soundly without medication. So my work really stems from personal desire to learn more about sleep. So I got started because I have always considered myself to be a night owl. And we live in a world that very much caters to the early bird. I definitely struggled with my own sleep for many years. And that's what led to me doing a deep dive into sleep and actually finding out that you can pursue this very small subspecialty of psychology. And by nature of my work as a clinical health psychologist, a lot of my trainings were in medical centers and hospitals. And as you can imagine, if you're in the hospital, even though a lot of healthcare providers say, oh, you need to sleep to recover, they also interrupt your sleep quite a bit. So the number one complaint that I would hear from folks in the hospital is, oh, I can't sleep, especially having to be woken up during the night. It became really interesting to try to adapt sleep interventions in the hospital setting. And that ultimately led to more of a specialty in behavioral sleep medicine. And believe it or not, there aren't many specialists like myself, even to date, even though we know sleep is such a huge issue. But there is, last time I checked, less than 800 of us in the United States. So very hard to find. And I think that number is slowly growing, but it can be really hard to find sleep specialists, especially sleep psychologists.
Yeah. Well, it's so interesting you said that too about sleep in the context of a hospital. And it is disconnect in a way because this is obviously if you're hospitalized for a medical reason, this probably is a time where rest and recovery are so pivotal and fundamental. And yet I can't think of a harder place to sleep. And when I had my son, I was recovering from an emergency C-section. I remember I had just been up, I don't know, like over 48 hours and just could not sleep. And I remember that such a scary feeling because I was holding my son and the nurse came and said something to me. And I realized like I couldn't form coherent words. The language wasn't coming to me. And God bless her, she came to me. She's like, I'm taking your baby. I'm going to take your baby away. You are going to sleep. That is what has to happen now. And I think just that piece of people are coming in at all hours of night and wires and lights on, and it is so disruptive. So I think that's so critical that you were really wanting to get curious about that question of how you can support people sleeping in the hospital.
Yes, thank you for that. It truly is. It's like a counterintuitive because we want you to be able to sleep as much as possible, but then we do everything to disrupt sleep as well. So I think that is starting to shift, but it's really hard depending on the level of severity in terms of what you're in the hospital for. But in any case, that has certainly, my experience working in the hospital has certainly carried over into the outpatient setting. And now through my clinical practice as private practice provider, there are still a lot of parallels and a lot of overlap there. And I could say that really all ages across the lifespan could benefit from some of these evidence-based interventions.
Yeah, amazing. And you described yourself like a self-proclaimed night owl. Would you say that there is a biological genetic component to that? Is that just a pattern that's for a routine that's established early on if people are early risers or night owl? What is your sense of how predetermined this might be for folks?
Yeah, thank you so much for this question because there are a lot of misconceptions about whether someone is truly a night owl versus a morning lark. And very recently, we've actually discovered that we do have specific genes that are named clock genes that can actually predetermine whether someone is more of an early bird or more of a night owl or somewhere in between. So, yes, actually, the scientists who discovered these clock genes won the Nobel Peace Prize in 2017. So fairly recently in the grand scheme of things. And so we know that there is likely a big genetic component to whether someone identifies as more of a morning person versus night owl. I will say, having worked with a lot of night owls over the years, I do think that lifestyle and technology and screen use can play a huge role here and can sometimes further delay someone's sleep schedule. But when someone is truly a biological night owl, when they've done all the things and they're still struggling to wake up early, oftentimes there is likely somewhat of a genetic component there. And I have certainly seen folks who are, you can call them super early bird, so going to bed 7, 8 p.m., waking up 3, 4 a.m. before the sunrise, what would be considered more of having an advanced circadian rhythm. And then I have also seen folks who are the complete opposite. So folks who don't get sleepy until 2, 3, 4 a.m. and then who might wake up 10, 11, 12 in the afternoon. So there's a very wide range of sleep schedules that could be considered normal depending on the individual. And I have to say, I think the night owls have the biggest challenge living in today's world, just because there is this very big societal expectation to go to bed early, wake up early, early bird gets the worm, that kind of thing. So I do tend to see a lot more biological night owls in my practice as a result. So there are definitely things that are helpful as far as managing and shifting someone's sleep schedule, but ultimately it's like fighting biology for a lot of folks, which can make it really challenging.
Yeah, that puts a lot in perspective. And I think just even our conventional wisdom about sleep hygiene practices, just that piece is there's so much more complexity to it. And for some folks that have to override this genetic expression of who they are. And I think these messages we get about like morality and success, about early risers, the 5 a.m. club, all of these things, but also just very practical things. Our society is built around this idea that you'll rise early in the morning, you'll have to drop off your kids in that range. Most people, barring certain professions and shift schedules, the business day operates within those parameters. So I can definitely see just how that can become such a challenge. But for the people that are listening, everyone feels tired these days. From your perspective, why is sleep such a widespread struggle in our modern society?
Yeah, so I love this question because there are so many different reasons for why sleep may be a struggle. And I hear this every single day from folks that I work with. I do want to also just mention, to loop back around to the night owl versus early bird conversation. I think that kind of ties into this because depending on where you fall in what's referred to as your chronotype, your unique circadian rhythm, this can truly make or break how tired you might feel during the day. For example, someone who truly feels like they're a biological night owl, where their sleep schedule, for example, is like a 2 a.m. to 10 a.m., but they have to wake up at 6 a.m. for work every day, they're absolutely going to feel extremely tired. Their sleep timing is off. There's a mismatch between their internal body clock and their social or environmental work schedule. So that can certainly lead to a lot more tiredness during the day. And in the sleep community, we actually like to think about these different chronotypes from an evolutionary perspective. So if we think back to our caveman days or cavewoman days, we wouldn't have survived as a species if we were all asleep at the exact same time every night. We believe that we have evolved to have these different chronotypes, these different sleep schedules, in order for someone to be up at all times of the day versus night to protect and to keep everybody safe. So I think that chronotype piece and knowing where your chronotype is incredibly helpful to, if you can, it's not always possible, but if you can actually sleep in that natural sleep schedule or as close as possible to it. So I think chronotype is a huge part of this overarching struggle in today's modern society. And to add to that, I think just the pace of modern life. We live in a world where we are expected to always be on all the time, always be available. There's still that hustle grind culture where, like, you've heard the classic saying, I'll sleep when I'm dead, that kind of thing. There's still a lot of workplaces and folks who actually still believe that to be true. And so there is this idea that sleep is often treated as optional or a luxury rather than a biological necessity. And so I do think that a lot of people, as a result, cut their sleep short to meet work demands or to meet social family demands. And I know it's easier said than done. It's tough, but I think that's definitely a big piece here as far as why folks are feeling a lot more tired during the day. And then also there's big overlap there in terms of chronic stress and just the mental load of daily life, especially for women, especially for caregivers, for parents, for high achieving professionals, high performers, where it's really hard to go from being in 95-mile-an-hour mode during the day and then hopping into bed at night and just expecting for sleep to happen quickly. So there's a lot of pressure in a lot of different ways that I think most folks are juggling with on a day-to-day basis.
Yeah. No, that's so true too, because I do feel like so many of the people that I work with are overscheduled until the second they get into bed, often in bed with their device and still like doing things to the very last movement possible. And it's like you're driving a speeding car and then you're slamming on the brakes. And it's just there's such a state of acceleration and that hoping to transition into a restful state. And that sleep isn't it's not getting knocked unconscious. It's a process of rest and recovery. I could see why it's at odds. That's so interesting you were saying about the chronotypes, because I think we often pathologize these things, including sleep disturbances, and even just having that lens of these variations in sleep schedules were actually probably quite adaptive. And how can you have that curiosity? I'm sure there's sometimes that unfortunately someone's chosen profession or their life just cannot be as cleanly cohesive to that sleep schedule as they would hope. But I'm sure there's also people that actually could, instead of fighting this and resisting this, is there a way to lean into potentially how you naturally rest and recover? I work with a lot of people that falling asleep isn't as much of the problem as staying asleep. And do you see that as potentially part of a chronotype, of a genetic manifestation of how sleep is, or is that something you would see more as a sleep disturbance?
It's a fantastic question, and it's something I see every day in my practice as well. So it could be for a number of reasons. It could certainly be a sleep timing issue. So where someone is trying to sleep in a sleep window that doesn't align with their chronotype, and that can certainly lead to a middle of the night awakening. More often than not, what I see in my practice is often it is an undiagnosed sleep disorder. So something along the lines of either insomnia, which could look like trouble falling or staying asleep, or something like sleep apnea, which is often completely overlooked and undiagnosed in women especially, but in general, it goes completely undiagnosed. So that could also be one of the causes of waking up during the night. There are also a number of other kind of normal changes within the body that can take place at that time of the night. For example, for some folks, that could be a drop in blood sugar, and that can lead to waking up. For some folks, it's the urge to go to the bathroom that leads to waking up. It could be a spike in cortisol or a main stress hormone that leads to waking up during the night. So there could be a number of different reasons for those wake ups. And I do think it's helpful to work with a sleep specialist to tease apart what might be driving the middle of the night wakefulness, because it could be several things, but ultimately to understand what is actually causing those wake ups. And I will also add, sometimes it's a very normal time to wake up. If this doesn't get talked about enough, we as humans wake up multiple times during the night is actually part of our sleep-wake cycle. So after we complete each of our different sleep stages, we complete a full sleep cycle, which is on average about 90 to 120 minutes. We wake up, whether or not we realize it, or most folks just have no memory of those wake ups. So I can bet that for most people who probably sleep a couple hours that first half of the night and then wake up during the night, that first wake up is probably a very normal time to wake up, usually to use the bathroom the first time of night. And it's not inherently a problem either, as long as you're able to fall back to sleep quickly. So within 15, 20 minutes, give or take, it's actually considered a normal or healthy amount of time to be awake during the night. So if it's prolonged, on the other hand, so where someone's waking up and then they're taking an hour to fall back asleep, that could be something more along the lines of, say, insomnia or sleep apnea or another undiagnosed sleep disorder, which would warrant further evaluation, but could be a very normal time to wake up for most folks.
Yeah. And this is where I think your expertise in the sleep education, being a little bit more in depth and nuance, is so critical, because I think for so many people that I work with, once they're awake, right, there is almost like an internal alarm that goes off. It's, oh shit, it's 1:30 in the morning and I'm supposed to have the presentation tomorrow and I'm up, and almost the vigilance and interpretation of threat of being awake when they have told themselves that they're not supposed to be awake spikes this entire cycle that probably becomes a barrier to falling back asleep. And even just normalizing, oh no, like that's normative. People, there's sleep wake cycles and you will likely wake up for periods during, I think, would sort of tamp so much of that down for many people. But I think some of the sleep education reaches a certain level and then we stop there. So I think these insights are really critical.
100%. And I do think that there's a very big misconception about sleep where we should all be totally unconscious for 8 hours and not wake up at all. And that is farther from the truth. Sleep involves wakefulness. And so it's okay to embrace a little bit of wakefulness during the night. It's not inherently a problem. I would say once it starts to become a problem where you feel like it's taking you a while to fall back asleep, or it starts to really affect how you feel during the day, where you're noticing changes in mood and energy levels and concentration, attention. Once you start to feel like it's becoming more of a problem, then certainly talking with your doctor and perhaps seeing a sleep specialist would be the next step. But certainly important to normalize waking up during the night. It is very normal. Most adults wake up anywhere between 5 to 15 times every single night. So it's a lot. Again, most people just have no memory.
Okay. Yeah, absolutely. And just to go into the next question, I don't know if it would be helpful just to hear from your perspective what makes restorative sleep. Because my question is, what are the psychological factors, stress, anxiety, burnout, with our ability to get restorative sleep? And is there a meaningful difference between I've slept 8 hours and I've slept well 8 hours? Do you have any kind of thoughts on that?
Absolutely. Yeah. I mean, you bring up a great point. So getting more sleep doesn't always mean that it's good quality sleep. Even though sleep duration is important, so you want to make sure that you're getting as many hours of sleep as your body needs, that doesn't always mean that it's going to be restorative or restful sleep. So, yes, I would say to kind of help tease apart whether you are getting restorative sleep at night, one kind of general rule of thumb to consider is what's called the 30-minute rule of thumb. And what this means is if you're able to fall asleep initially within 30 minutes or so, that's actually a normal time for what's called sleep onset latency, so the time that it takes you to initially get to sleep. And then 30 minutes total time awake during the night is also considered a normal amount of time to be awake at night. So 30 minutes on the front end, 30 minutes total time awake during the night. That is a normal or healthy amount of wakefulness to experience. So if you're underneath that umbrella, that's a general guide, if you will, that likely determines whether or not you're getting restorative sleep. I will also add to that sleep duration. So the number of hours of sleep that your body needs in order to feel well rested. This number can change throughout our lifespan. Of course, when we're babies, kids, teens, we need more sleep in general because we're growing. But as we become adults, that number may level off. And then as we become older adults, it may also shorten. And not all the time, but for some folks, they just need less sleep as they get older. Sleep certainly changes in women during the perimenopause, menopause, and postmenopause phases. So there are some unique changes there for women. But sleep duration is very important. So you want to make sure you're getting enough sleep. The other piece here is sleep quality. So that, to loop back around at that 30-minute rule of thumb, you want to be able to be falling asleep pretty quickly within 30 minutes or so. And then if you are waking up during the night, up to 30 minutes or so, time awake is okay. So the quality piece. And then timing. Sleep timing is also part of this restorative sleep picture. And that really speaks to chronotype. So you could, for example, you could be getting 8 hours of sleep, but if you're sleeping in a different sleep window or sleep schedule, that is a mismatch between your internal body clock timing, your own unique chronotype. That might lead to your sleep feeling non-restorative or non-restful. So sleep timing is also very important here. So I'd say the sleep duration, sleep quality, sleep timing, those are the three big areas that ultimately determine whether or not you're getting restorative sleep.
Really helpful to understand. So you spoke about developmentally and biologically over the course of the lifespan, things like perimenopause having potentially an impact just about the duration of sleep that's needed. What is the interplay of stress, anxiety, burnout in terms of how that winds up actually showing up in getting high quality sleep?
Yeah, I love this question because I'd say psychological factors are some of the biggest sleep disruptors. So stress, anxiety, burnout, I would say also play a crucial role in how restorative your sleep may feel. And this really speaks to, I would say, our classic fight or flight system. So our sympathetic nervous system and how this may play a big role in how restorative your sleep feels. And I actually see a lot of this play out in the work that I do as an insomnia specialist, since a lot of the folks that work with me are likely dealing with a history of chronic insomnia. So either trouble falling asleep or trouble staying asleep, combination of the two. And oftentimes there is this very big anxiety, fight or flight activation, if you will, that is driving the insomnia and also perpetuating the insomnia as well. So when we think about stress and sleep and the relationship between the two, stress ultimately keeps the body in that classic fight or flight mode, that alert mode. You can call it hypervigilance, being on high alert, feeling like you're on overdrive all the time. And that can also elevate your cortisol, your main stress hormone, in the evening, which cortisol and melatonin, I like to think of them as they're on a seesaw. So when one is elevated, the other should be low. So when we are in this constant state of fight or flight and our cortisol is elevated, that can actually change the way in which our melatonin gets released, the melatonin being one of our main sleep-inducing hormones. So there is likely some, you could say, negative effects when it comes to having that elevated cortisol or spike in adrenaline throughout the day, where it actually impacts how your body winds down and ends up releasing your own natural production of melatonin. That can look a number of different ways, but oftentimes it is either having difficulty falling asleep or waking up during the night and then having trouble falling back to sleep. And then that elevated cortisol can also keep you in lighter sleep in general throughout the night. So you still might be getting all of your different sleep stages, but you might be spending less time in, say, deep sleep or REM sleep, for example, and you end up just what I like to call sleep surfing. You just skim sleep and you're stuck in light sleep, which can feel almost as if you're awake. Sometimes, like such a light stage of sleep. I have a lot of my clients will refer to it as twilight sleep. So you're like in this half awake stage. And that is often a result of being in that fight or flight state. So sleep just feels less restful, a lot lighter, and a lot more fragmented or interrupted. I see that a lot in the folks that I work with who have been dealing with insomnia for some time. And I will say oftentimes when there is this increased fight or flight response, that is often at the root or what's driving the insomnia or the sleep disturbance. I think for a lot of folks, it ends up becoming what's now referred to as sleep anxiety. So it's almost like a completely different beast of its own, where it's not just generalized worry, it's now very specific anxiety related to sleep and the actual fear of going to sleep or fear of being awake during the night. Also fear of not being able to function the next day. So there's a very specific anxieties and worries that develop as a result of having chronic sleep issues. And ultimately being in that state of fight or flight, it looks different for everybody, but I'd say typically it's having racing thoughts. As soon as you hit the pillow, your mind is running a mile a minute and really hard to turn off those thoughts. So racing thoughts, worry, rumination, which ultimately makes it nearly impossible for the brain to switch off and get to sleep. And that can also look like anticipatory anxiety. So it doesn't always have to be something that is negative per se. Like you could be anticipating a vacation, a fun upcoming trip or early flight or something exciting, but that could still potentially disrupt sleep. And that can look like the anxiety or that increased sympathetic activation, that fight or flight mode, interfering with either falling asleep or getting back to sleep. So it's incredibly common. And it's also often described as feeling very tired but wired. So the body tired, but your brain is wired, and it's hard to turn that off. And that's a very common experience when dealing with sleep issues.
Yeah, absolutely. And one of the things that I find with some of the folks that I work with that struggle with that is their impulse to try to deal with that is they almost use media, like having the TV on in the background, having a podcast on, having an audiobook as a way to drown out their own internal noise. And it's this very interesting dynamic of silence and stillness feeling more activating than having some of these other inputs that almost are needed to drown out that internal experience that you're describing.
Absolutely. And you described it so perfectly. Yes. And I do see that a lot more these days where, especially if you haven't been sleeping well for years, the kind of go-to approach is to use screens or technology to drown out the noise, if you will. And I do think it's hard for humans in general to sit with discomfort. And so sometimes, even though screens are not necessarily an ideal approach to getting to sleep, sometimes in the short term, that could potentially be helpful as a way to get to sleep if it's something that's distracting from that noise. So I think it really does depend on the individual, but I do see that as very much kind of a coping skill for a lot of folks who might struggle with sleep or anxiety or stress in general.
Yeah, as humans, we have a lot of creative survival strategies. So definitely see that. Can you talk to us about the biological side? So we know we don't feel well when we're not well rested. We know that we feel groggy or crappy. We can't think well. But what is actually happening to the brain and body when our sleep does get disrupted?
Yeah, a lot happens because we now know that sleep is a very active process. It's not merely just a turning off of the brain. In fact, there's so many different regions of the brain that have to be active in order to perform like cleansing of toxins from the day. So I'd say in the brain that there are a couple of big changes that are important to consider here. So when your sleep gets disrupted, depending on the time of the night, so usually we get our deep sleep, or also called slow wave sleep, in the first couple of hours of our night. So if you're having trouble falling asleep, that might be the time of night where your slow wave or deep sleep might be most affected. On the other side of our sleep timing, our sleep schedule, in I would say middle to end of our night is where we're typically getting more light sleep and REM sleep. And actually REM is typically closer to our final wake up time. So this would, as an example, if you have to wake up an hour or two earlier than usual, you might be carving off some of that REM time in the morning. So that could certainly shorten the amount of recovery time that you might be getting in REM. So it depends on where your sleep is getting disturbed, what time of night, in terms of its impacts on specific sleep staging. But I will say in general, if you're not getting as much deep sleep or slow wave sleep at the beginning of the night, that is actually the time of night where our brain does a lot of cleansing. So actually in very recent years, we've discovered what's called the glymphatic system. And it's almost like your brain car wash. It cleanses all the toxins and plaque buildups from the day. And it's so important for a number of different reasons, but mainly to make sure that your brain clears all the toxins that it needs to. During deep sleep is also our time for muscle repair, tissue repair. It's also where our immune system builds up that functioning, which is so important to ward off infection and sickness. So there are a lot of physical benefits to getting as much deep sleep, slow wave sleep, as well as brain benefits as that too. And then as far as REM sleep goes, so if your end of your night is being disrupted, you can think of it this way: slow wave sleep or deep sleep. Yes, a lot happens to clear the brain of toxins. There's a lot more physical repair happening during slow wave sleep, as opposed to REM sleep, which is more a mental cleansing or mental recovery. So things like learning and memory consolidation and emotion processing, those are all things that take place during REM that could be shortened if you have to wake up early or your sleep gets shortened as a result of work, life, kids, etc. So there are different negative effects if your sleep gets disrupted, depending on the time of night. And then I would say in the body, as a result, that could look a number of different ways as well. But probably the most common that I tend to see is if your sleep gets disrupted, cortisol is likely to stay elevated, and that can certainly lead to more stress, worry, anxiety, potentially changes in metabolism for some folks. So potentially, for example, eating more calories the next day, which can over time lead to more weight gain and more inflammation. And so that can certainly have a downstream effect, if you will, and also ties into like immune system functioning, impacts on cardiac health, and also, of course, hormones in terms of those being well regulated as a result.
And now a quick word about our amazing sponsor, Jane.
Can we agree on something? Therapists are already doing enough. You're managing care, notes, scheduling, billing, all while holding space for everyone else. The last thing you need is a system that makes it harder. That's why I switched to Jane. It's intuitive, it's beautifully designed, and it just works. It saves me time and protects my energy. The customer support alone is worth it, but the smoother workflow, that's what made it a long-term solution for me. Use code AFFIRM1MO to get a 1-month grace period. Switch to Jane and see what it feels like to be supported by your EHR for once. Time to decide if Jane's a better fit.
Big thanks to Jane for supporting this podcast. And now back to the interview. Yeah. And it sounds like we can all immediately feel that impact of not getting good quality sleep, but it is really interesting to think about cumulatively over time what that looks like, especially to those I'll sleep when I'm done folks, what potentially might be over time getting impacted. You mentioned this system that is essentially functioning like our mind's car wash, and that's dealing with toxins and plaque buildup. In the absence of that effectively being catered to on a consistent basis, what are some of the most common sleep-related health conditions that come up related to those toxins not being effectively cleared and plaque buildup in our brains and our body?
Yeah, this is such a great question, and also sad to think about because there's probably just about every single chronic health condition can be linked back to poor sleep. And it's hard to say whether it's sleep itself that is causing those issues, but to date, I'd say it's some of the biggest chronic health conditions that are linked to poor sleep, and especially having this decreased deep sleep or full sleep on a cumulative basis are things like diabetes. I would say a lot of heart issues, so heart attack, stroke, and then even more so brain health-wise, things like cognitive impairment, potentially dementia as well. So those are the big ones. But I think that probably most chronic health conditions can be linked back to sleep in some shape or form.
Yeah, but it is really sad. And it also frustrates me because I work with a lot of medical residents, and the systemic issues of the way that residency is structured, on top of it being very routine to work more than 70 hours a week, which on its face is already so bad for your mental and physical health. But then also having things like 24s where they have to stay up and work a 24-hour shift with no guarantee of breaks for any sorts of rest, and things like the rotations where they'll have a 2-week block where they'll be working days and then with maybe a very short period of like 24-hour, 40-hour in between, then go to working 2 blocks of nights and that like will go back and forth for a period of years where they have those sorts of limitations. And there's lots of things that obviously going to be a medical resident that I think put them at a higher risk of burnout. But for me, the one that feels so most obvious and foundational is just the way that it is almost impossible, even if in the best case circumstances, to have regular, consistent, high quality sleep through most medical residency programs. And it's so hard because I think it's so normalized in that system. People feel bad that they struggle physically and emotionally with the sleep deprivation, but how can they not?
Of course, yeah, so tough. And I have to say, having worked with a lot of medical residents and just healthcare providers in general, my heart goes out to them because we live in a world that we need these folks, right? We need them. And so they're vital to our society. But we also know that shift workers, there's likely the highest risk there to develop these long-term health consequences. Like we now know that shift work is a known carcinogen. And so it is always a challenge in working with shift workers, because as much as possible, we want to be able to gain consistency. And there are some folks who can have what are called anchor sleep episodes, where we can align their schedules so there is some more consistency throughout the week. But it's incredibly hard when we're talking night shifts, rotating shifts, where sometimes it's impossible to come up with consistency. And so that does make it incredibly challenging. And most of the time, these shifts are somewhat temporary, but I think you bring up a great point. It's our healthcare providers, it's people who are caregivers who ultimately really suffer with being able to get enough sleep and don't even have the opportunity to get enough sleep. It becomes a very big struggle and a challenge. There's still some things we can potentially do on a short-term basis, and that really does depend on the person's schedule, since it's different shift work schedules are so unique and variable. But it's tough in the grand scheme of things. So I always try to meet people where they are and figure out a schedule that's going to allow them to gain some consistency, but it's tough.
Yeah, absolutely. It was just powerful to hear that, like, shift work being a carcinogen, and oftentimes shift work is residency, a certain example of this, but caretaking roles, I don't know, like things like truck driving, where, they have to do these long hauls. Or my husband used to work as a doorman, and he had a swing shift, so he'd have to do one overnight shift and then like a morning shift and all of these things. If some of these things can't be fully corrected, even just acknowledging that maybe there needs to be some supplement of hazard pay. Maybe these should not be the jobs where, that in addition to being put in these highly hazardous sleep conditions, that they were also oftentimes underpaid and not adequately resourced for the toll that is happening on their body. Not that's going to fully compensate, but to at least acknowledge it, which I feel oftentimes we're not on a societal level doing in terms of labor protections for those folks.
Oh, I couldn't agree with you more. That would be the dream. Because those folks who are in these caregiver support roles, shift workers, especially healthcare providers, and EMTs, firefighters, doormen, all of these folks who have these swing shifts, they're so vital to the way that our world works. But I do think that they should be fairly compensated.
Yes, absolutely. I think it's really important, probably as a lot of people who are listening to this conversation and can relate and hear themselves. Many of us are in these poor cycles and patterns with our sleep hygiene. And then upon rising, we're hitting the coffee right away. We're heading over to Dunkin' Donuts. We're getting the Red Bulls during the day. What is the impact, caffeine being one, but I think there are others as well, the stimulants and substances that people are using to override fatigue, probably related to sleep issues. What's actually happening in the body there when we're pushing through exhaustion with caffeine or energy drinks or alcohol?
Yeah, absolutely. I love this question because I think most of us are guilty of having a little bit more caffeine the next day after a not so great night of sleep. But it ultimately can become this vicious cycle. First, start with caffeine because it is such a widely used drug, stimulant. Get it anywhere. But I will say, from a sleep perspective, the chemical in the brain that is most closely associated with our sleep system is what's called adenosine. And caffeine blocks adenosine from building. So the reason most people feel this sense of alertness or energy, it's not because the caffeine is giving you energy. It's because it's blocking your natural sleep drive for a few hours or so, depending on how you metabolize caffeine. So could potentially be what I like to call a strategy, depending on somebody's work schedule. Caffeine can be really helpful for shift workers or for folks during the day where you need to be, quote unquote, on and fully alert at certain times of the day. But ultimately, it does end up blocking your natural sleep drive from building. And in terms of caffeine and its half-life is referring to the amount of caffeine that's still in your body even hours later. So, for example, What we know about caffeine half-life is, on average, it has about a 6 to 8 hour half-life, depending on the person and how someone metabolizes caffeine. So if you have a cup of coffee 7 or 8 in the morning and your body metabolizes caffeine about 8 hours or so later, 8 hours after you're done consuming that first cup of coffee, there's still half the amount of caffeine in your system. So depending on how much caffeine you're consuming and what time of day you're consuming caffeine, that could ultimately have pretty big impacts on how you fall asleep and also overall quality of your sleep. So even if you don't notice any big changes in terms of how long it takes you to fall asleep, we actually know that caffeine can keep you in lighter sleep throughout the night, so it may not be as restful or as restorative of sleep as a result. So half-life is important to consider, and then there are a number of different issues that also play a role there. So for example, women who are on birth control, women who are on hormone replacement therapy, or women during pregnancy, the half-life actually extended quite a bit. So it could be 10, 14 hours, depending on how someone metabolizes their caffeine. So that could mean that 10, 12 hours after you're done consuming a cup of coffee, there's still quite a bit amount of caffeine left in your system. So it really does depend on how fast or slow you metabolize caffeine and how sensitive you are to it. But we do know that it blocks your natural sleep drive from building and then could potentially have effects on both sleep onset, latency, so the time that it takes you to fall asleep, as well as your overall sleep quality and how restorative your sleep may feel.
Yeah, absolutely. And you mentioned that your specialty is uniquely about supporting people in sleep and getting restorative sleep without the use of medications. Do you have any thoughts about non-prescription supplementation, like things like melatonin? Because I feel like that's become, I don't know, like a craze. There's just been a lot of different, conflicting information. Any thoughts on that?
Yes, I have a lot of thoughts on melatonin. So melatonin is actually not a sleeping pill. Melatonin is a hormone that regulates the timing of our sleep-wake cycle within our own body. So our natural melatonin does that. When we take over-the-counter or supplement melatonin and we take it at the wrong time, or we take too high of a dose, that could actually alter our own natural timing of when our own melatonin gets released. So there's a big misconception about melatonin that is this sleeping pill, this sleep aid. And believe it or not, most sleep specialists are not likely to recommend melatonin as a standalone treatment, especially for insomnia or especially for most sleep issues. So while I would say in some instances it might be helpful, and some of those could look like folks who are biological night owls and they need to shift their schedule earlier, or shift workers, the melatonin could be potentially helpful at a very low dose, but the timing and dosage is really important to making sure that it's effective. When we're talking melatonin as just if you're having trouble sleeping, just take it before bed, especially right before bed or even 30 minutes before bed. It's likely not going to have much of a therapeutic benefit. Now, with that being said, I do have a number of folks who swear by it and believe it works. And to that, I say there is a very big placebo effect when taking melatonin as a supplement. And that's real. That's a real effect. Of the things, or I should say, of the sleep aids out there, melatonin is probably on the safer side. However, we don't have great long-term data on melatonin. So we don't really know what the long-term implications are if you're taking it on a regular basis, so more as a chronic sleep aid. So it's not a great, melatonin is not a great sleep aid when taken at bedtime, and it is not a standalone treatment for insomnia, which a lot of healthcare providers might recommend that to be something to try. And in my experience, it often actually backfires or makes things worse. I will just add that, like many other supplements here in the US, melatonin is not regulated. It's marketed as a dietary supplement, and it is a hormone. So it is important to keep in mind it is a hormone. It is not regulated. You don't really know what is actually in the melatonin products that are available. And there's been a lot of research that has actually looked into the most common melatonin brands out there. And there is such a huge discrepancy between what's on the label and what's actually in the pill. So just to speak to, you don't know what you're getting in terms of quality and purity and whether they're tested for other fillers and additives. And more often than not, there's a lot more fillers than there is actual melatonin. So very much a business, if you will,
Yeah.
not typically going to be helpful as a traditional sleep aid.
Yeah, absolutely. And I think this is just a good segue to also just most of the clinical folks that are listening are non-medical licensed therapists. And part of this sort of acting within our scope, but also being keyed into this issue to give folks the best support. It's knowing to when to have those conversations where we recommend them consult with a sleep specialist explicitly. Because it sounds like if they could go to a very well-meaning non-specialist who may encourage them to try some of these supplementations, that maybe a sleep specialist may have a different insight into the risk versus benefits for that kind of intervention for somebody who is struggling.
Yes, I would agree. I think if someone is struggling with their sleep, you kind of sense that they're having any trouble falling or staying asleep, then best practice would be a referral to a sleep specialist because there's a time and a place for melatonin. It can be an appropriate supplement, can be a tool for some folks, but similar to medication, there are some folks where certain medications can be incredibly helpful on a short-term basis, but may not be the best long-term solution. So a sleep specialist can certainly tease apart whether or not melatonin is actually appropriate for the individual. And so that would certainly be a best practice for clinicians.
Yeah. It's interesting too, because you mentioned in the beginning that sleep apnea is underdiagnosed, particularly with women. Is there anything else that, like, even supporting and advocating for clients in speaking to their doctors? Because sometimes, depending if the person you're working with may have an HMO, maybe they can't go directly to they can't just find a specialized sleep medicine doctor to meet with. Perhaps they have to go through their primary care doctor who will need to identify if there's a need for a referral to a specialist. Are there things we should be encouraging folks to advocate on their own behalf? Like things like screening for sleep apnea explicitly?
Yes, I love this question because there's a very long list of potential signs or symptoms that might be present that are worth bringing up with your doctor. But some people can't necessarily go straight to a sleep specialist. So first step would be talking with a primary care provider. So of the long list of signs or symptoms to keep an eye out for, I'd say the most common are trouble falling asleep. So if it's taking a long time to fall asleep, trouble staying asleep. So if sleep is disrupted, especially if someone is waking up multiple times during the night and they're awake for a prolonged period of time, when sleep becomes very fragmented or broken, someone is using the bathroom multiple times during the night, that's actually a big red flag for sleep apnea. Of course, the big ones are snoring, which in women is sometimes tricky, right? Because we don't really know if we're snoring unless someone else hears our snoring or observes us, but you don't have to snore to have sleep apnea. But snoring is often a very big sign or big red flag. So snoring's a big one. I would also say morning headaches. So waking up with headaches on a regular basis, dry mouth, like a sore throat, post-nasal drip. Some people describe as like a cotton mouth. Grinding or clenching your teeth while you're sleeping and waking up feeling like that tension in the jaw. That's also a big sign. And then there are, of course, a lot of daytime signs to look out for. So when someone is tired all the time, regardless of how many hours they sleep, especially if they're sleeping 8-9 hours, but still feeling exhausted, say that could definitely be a sign. Falling asleep during the day on a regular basis. So whether dozing off, say at your desk or in sitting, or needing to nap for a prolonged period of time on a regular basis. So daytime sleepiness is also a very big sign. In women, I also find that changes in mood, especially having more symptoms of anxiety and depression, are often thought to be more on the mental health side of things, but could actually be sleep apnea. So that there's a very big relationship there in terms of mood changes and some of these other symptoms that might present during the night. So lots of physical changes, but also I'd say more mental and brain changes too.
Yeah, absolutely. Absolutely. No, that's really helpful. And I think when something like poor sleep is so common, there's almost, I think, an instinct to mean the prevalence means somehow it's not serious. And I think that is also what kind of sometimes prevents people from taking more intense steps to get targeted supported medical intervention around this.
I agree with you so much on that. And I think part of the reason for that is because most medical providers don't get any sleep training during medical school. And actually, Harvard did a study on this a couple of years ago where they found that most primary care docs get less than 2 hours of sleep training throughout their 4 years of medical school. So unless your doctor specializes in sleep, they probably don't know how to ask about your sleep, how to evaluate, how to properly treat. I do think talking with your doctor is, of course, a really great place to start, but sometimes we have to advocate for ourselves when it comes to our sleep because, again, unless your doctor actually specializes in sleep, they might not actually ask about it or bring it up. Yet sleep is, in my opinion, the foundation of our health. Once your sleep is dialed in, that trickles into other areas of our health, like nutrition and exercise and our motivation to do those things. So I think it certainly is a systemic issue, if you will, where the very people who are seeing folks in the medical setting and the healthcare setting just don't have the training to properly evaluate for sleep issues.
Yeah. And coupled with that, probably many of them being sleep deprived themselves. So that's
Yeah. Well, sleep deprived and they know ritual. What you feel like could be sleep deprived.
yeah. Yeah. No, but that's so interesting because I think you would assume, and this goes for some other foundational things like nutrition, that, oh, of course, like every medical doctor is going to be so well primed in our sleep and our nutrition, these foundational building blocks of health and well-being. And to no fault of their own, that's really just not how the system is designed. So then what gets missed in terms of assessment and intervention when it's not really baked into the medical education in that way? Yeah, no, I could see that having such a huge downstream impact when it's really seen. Again, the specialization is fantastic. Most people will not be the people suffering from sleep disorders versus the people who actually make it to a specialist. And there's a huge sort of disparity between those two groups.
Yeah, 100%. I think probably a big fall off, especially when a sleep specialist is recommended. I will also say, I think a lot of folks who have struggled with their sleep for years, they get really discouraged because oftentimes they go to their doctor, they say, hey, I'm having trouble sleeping, and their doctor gives them a list of sleep hygiene tips. And while sleep hygiene is important, it is not a curative treatment for true sleep issues like insomnia or sleep apnea, for example. So sleep hygiene, I always like to give this analogy. It's very much like dental hygiene. And you go to your dental hygienist every 6 months or so to get a cleaning. It helps to maintain good oral hygiene. But if you go to your cleaning appointment and you have a cavity or you need a root canal, you can't just see your hygienist to get that fixed. You have to see the dentist. So you need that specialized approach to actually target the problem. And in the same way, sleep hygiene is important. It helps to maintain good sleep if you already have good sleep and you're sleeping, pretty well. It is not going to be a set of rules or things that you need to do in order to overcome chronic sleep issues like insomnia. So there are still a lot of misconceptions about what sleep hygiene is, who it's supposed to be for, and whether or not it's actually a treatment for things like insomnia. And it is not. In fact, folks that I see who have had chronic insomnia for years are experts in sleep hygiene. They're going above and beyond and are already doing all of those things, and yet they're still not sleeping well. So while yes, it's important, it's one piece of the puzzle, it is not a treatment for chronic sleep issues, especially insomnia. And I think that's where a lot of people will get that list of sleep hygiene tips from their doctor or whatever healthcare provider they're seeing. And they're basically looking at that and saying, I've tried all of this and it's not working. And then that's it. They stop. And when there are actually some really quality evidence-based treatments available that don't get talked about enough. And one of those is actually my specialty, cognitive behavior therapy for insomnia, or CBT-I, which is now considered the first-line treatment approach for chronic insomnia in adults. And it is not sleep hygiene. It's one piece of the puzzle, but usually sleep hygiene doesn't cut it. We need other evidence-based interventions that are actually going to move the needle and address the root cause of why someone isn't sleeping well in the first place.
Yeah. And not to go on a total tangent, but I just feel like what you said is so important because I think there's so many parallels in mental health and medical health treatment, just that I think we're just in this weird space right now in our current political climate and things where we almost see like science and medical intervention on one side and wellness and holistic interventions and sort of conventional wisdom on the other side. And rather than seeing these things need to be in partnership and one can like really support the other. And it was just reminding me of what so many of my clients that suffer from depression or anxiety go through, where they get just run of the mill advice about just get some exercise and get some fresh air and you need to be doing things and seeing your friends. And it's not that those pieces aren't true in the fact that those things are helpful, preventative, supportive of general mental health and well-being, but that in and of itself is not a cure and treatment for depression and anxiety. And I think that it feels very similar and where some of these things can start to be put on folks that are suffering as some moral failure. Oh, if you were only trying harder, if you were only doing the healthy things you're supposed to be doing, you wouldn't be suffering like this. And I think that's just such a through line of shame of so much stuff that life is already hard enough. And then we go ahead and we make it worse and amplify it by not having that sensitivity and applying some nuance to thinking about the importance of understanding that when there is something more severe and significant going on.
Oh, I couldn't agree with you more. And I think that's such a great analogy because you're right. It's not like exercise and eating and all these things we know aren't important, but they don't really address the underlying root cause for why someone is struggling. Don't really necessarily lead to more evidence-based treatments or interventions that most people truly could benefit from. Yeah, I think along the same lines, it's like sleep hygiene is important, just not the end-all be-all. And I think it's great to build healthy habits, great to build healthy sleep routines. If you're looking to clean up your sleep and you're already sleeping pretty well, it's great for that. But when it comes to sleep, there isn't a one-size-fits-all approach. And I think that's where working with a sleep specialist so you can really personalize treatment and what's going to make the most sense for you is so important to recovery and getting restful sleep.
Yeah, absolutely. So what would be your thoughts about how the rise of technology and screen time has impacted our sleep? And what is the science behind it?
Yeah, the science behind screen use and sleep is quite controversial. So it's very polarizing in the sleep community. There is a pool of sleep folks who really truly believe that blue light suppresses melatonin, our main sleep-inducing hormone, and that can delay sleep timing and really wreck our sleep. And then on the other side, there's a big pool of sleep specialists who have refuted some of that research and actually say, you know what, the light isn't actually as bad as we once thought it was. It's actually the content in which we're consuming on our screens. So I personally fall somewhere in the middle. I do think depending on the person, there are some folks who are more sensitive to light than others. And actually women tend to be a little bit more sensitive to artificial blue light in the evenings. So there could be that piece where you're in bed in a dark room and you have your phone right in front of your face and that light essentially is telling your brain that it's noon. So it's giving your brain confusing time signals. So there is that piece. And if someone is sensitive to light, it could potentially suppress your natural production of melatonin. And what we know by the research is, and this is going to vary, of course, depending on the person, but on average, about 15 minutes or so of a delayed sleep onset. And this is, I would say, further validated in teens and adolescents. So they're actually more sensitive and are likely to have more of a delay in sleep onset versus adults. So there is something there to the light actually suppressing our own natural melatonin release and that having its impact on how long it takes us to fall asleep. But on the other side of this, someone isn't as sensitive to light. The content on screens could make or break how long it takes someone to fall asleep or the overall quality of their sleep, how their body winds down for sleep as well. So if you're watching something that is lighthearted, mindless, that feels very different to the mind and body versus something like a horror movie or watching the news or something that's just more negative in nature that's really going to activate that fight or flight system. So I think content is key. Content is very important in terms of screen use. And just being mindful of screens in general. If you can minimize screen use before bed, that's fantastic. For some people, they do like to watch something or read something before bed on their phone. And so there are some very practical things you can use. So for example, dim your screen brightness because the intensity of the screen does matter. So dim it all the way down. And then nowadays there are blue light blocking softwares built into most phones. So Night Shift for iPhone, Twilight for Android. There are also blue light blocking glasses. And I always recommend red lenses, as that offers the most blue light blocking protection. So kind of ways to minimize that blue light exposure. But if you are using screens, there are definitely other tools that you can use to help further mitigate some of those negative effects on your sleep.
Yeah. I love we use that harm reduction approach because it's one of those things where some people, they're going to be like, yes, their therapist, sure, I won't have any screens, but with a wink and a nudge of that just may not be acceptable for them if it's just so ingrained and they have ambivalence about really changing that behavior. But I think most people, particularly with the content swaps, is some people can really get behind that. Or even just to go through the exercise of let's reprogram your algorithm. Let's really teach your algorithm what you want to see. And you can always go and clear your browser history after if you really need to find out about that triple homicide that happened in 2 states over, if you must. But let's not have your shitty phone offering that to you. Let's get the kitties, like the travel stuff with the whatever is motivating and feels comforting and soothing to you. And I think a lot of people can much more easily make that shift of I'm going to be really mindful of my it's so hard, I think, because we're the relationship that could be like a whole other conversation just about our relationships with our phones and our screens. But I think just starting where where they feel they have a little bit of agency and they can see themselves making that shift. It's I think a nice approach that most people can immediately start building momentum around and seeing some impact, because I think with chronic sleep disturbances, there can really be hopelessness that it's ever going to get better or that anything's going to change. I think when we can equip people with some things where they feel the impact pretty quickly and that can build momentum, that always is.
Absolutely. And meeting people where they are, I think, is so important to this sleep conversation because, especially in the work that I do, seeing a lot of folks with insomnia, if someone is using their phone to wind down before bed, and the first thing I say is, no, you have to completely get rid of your screen use and phone use before bed, right away, there's going to be some more anxiety around falling asleep. And so we have to be really mindful of how we're using screens. And sometimes they can actually be a helpful tool to get to sleep. But really speaking to that content piece, we want content that is not mentally stimulating or activating before bed. We don't want to further continue to reinforce that fight or flight system. We want content that is really going to help promote more of that rest and digest relaxation mode before bed. And so I always like to be as realistic as possible. And for a lot of folks, especially women who have kids, like kids go to bed, put the kids to bed, and then now you have some time to yourself, maybe the first time of the entire day to yourself, right? And so it is very common to want to have that extra me time using screens. So I always say give yourself permission, but have a hard stop. Maybe it's 30 minutes of screen use and then transition to doing something screen free. But
Yeah.
really taking a more realistic approach, and screens are not necessarily a bad thing to use for bad. It just make them work for you.
Yeah. Yeah, absolutely. I think you've already done a great job of speaking to some strategies people can start to think about right away. I know you said that like your specialty is CBT-I, which are there some key evidence-based strategies that you would want some listeners to know that really make a difference, that you've seen like really make an impact for people?
Yes, and I love this question because there are actually two evidence-based interventions that fall under the umbrella of CBTI that I think are, in my opinion, probably the two most effective components of CBTI that are maybe not as well known, unless you specialize in CBTI, but I think will be very helpful for your audience and clinicians who are listening. And you might have heard of these or maybe something along these lines, but they are actually considered monotherapies. And when we look at the research that has been done on these different techniques, sleep hygiene is often the control in the research, and we know that these are a lot more effective than just sleep hygiene alone. So one is what's called stimulus control, and that's the official term for this practice, but you might have heard of something along these lines. So it's essentially recommending that folks get out of bed whenever they aren't sleeping. So the kind of official protocol, if you will, is someone wakes up, and this applies for beginning of the night as well as during the night. Someone wakes up, they're wide awake, alert. It's been about 15, 20 minutes or so, and they just know that they're not going to fall back asleep anytime soon. And especially if they're feeling any negative emotions like worry, anxiety, stress, frustration. Best practice to actually get out of bed. So ideally move to another room, maybe the living room. You want it to be a coffee space. And in the other room, you actually want to recommend doing something that's both enjoyable and calming. So a very lighthearted activity, again, something that would be enjoyable, something to look forward to pass the time. And this could be reading a book or listening to an audiobook, podcast. I always like to recommend like putting together a jigsaw puzzle or playing a crossword puzzle, doing a word search, something that's lighthearted and fun. And then once you start to feel sleepy, as in you can get back into bed and fall asleep pretty quickly, less than 15, 20 minutes or so. That's when you would return to bed. So that over time, the brain actually learns that bed is for sleep and not a place for being awake or for any of those negative emotions that often get associated with not sleeping well, being awake during the night. If you ever heard the saying, bed is for sleep only, that's where this practice comes from. It's actually from this stimulus control technique.
Yeah, no, I think that's so important, and like resetting the emotional association with and just really solidifying that connection. Because I think so many people, the idea in that prolonged state, tossing and turning, it's just associated with so much dread and frustration and anxiety. So yeah, I could see that helpful. And I'm glad you said that caveat, and why it's so probably important to work through with a therapist is like getting into that zone, because I also have some folks that I work with that are like, just screw it, I'll just start my day, and they'll go to their laptop and start their work, and that it doesn't sound like that's not the sweet spot we're looking for. We're looking for sort of these like more like down regulating but pleasant. To me, it feels like more associated with soothing, like soothing behaviors.
Correct. Yes, very much self-soothing behaviors to pass the time, because eventually we will get sleepy again. It just might take a little bit of time. So yes, in the meantime, it's making it very clear for the brain that when you're awake, you're outside of bed. When you're actually feeling sleepy and you feel those sleepy cues, then you get into bed. And it's the physical act of getting into bed, the pairing of those sleepy cues with getting into bed, that really does help to retrain the brain over time. So very much classical conditioning, if you will. But it is one of the most effective behavioral techniques that falls under the umbrella of CBTI. So it is Very effective, although counterintuitive for most of us, right? Because if you're not sleeping well and you're awake during the night, of course, nobody wants to get out of bed when you want more sleep. So the typical approach is to stay in bed, toss and turn, and just lie there feeling very restless and maybe even anxious or worried. And so this kind of breaks that negative association and removes all of that from the bed and the bedroom over time.
Yeah.
So that could certainly be a very helpful technique to recommend to folks who maybe aren't sleeping well, been struggling with their sleep for some time. And then the second technique also falls under the umbrella of CBT-I. It's what's called sleep restriction. Although in recent years, we're now calling it a couple of different things that are less negative, as sleep restriction sounds so negative. Now it is often referred to as sleep compression or sleep efficiency training. That's the way that I like to talk about it with my clients, because we're actually training the brain to sleep more efficiently so that you can sleep more soundly. And so what this technique does is it actually takes the relationship between the time that someone is spending in bed and then looks at the time that someone is actually sleeping and brings those two variables as close as possible together. That kind of gives you a starting place for what's called a sleep prescription or sleep schedule for 2 weeks at a time. And the idea here being that we actually want to remove any of that excess time awake in bed where someone isn't sleeping. And I like to think about it as pushing sleep together into one solid chunk of time initially. So there is a little bit of restriction, if you will, but it's the time that someone is spending in bed awake. We essentially want to remove that so that whenever someone is in bed, they're sleeping the majority of time that they're in bed. That really helps to increase sleep efficiency and ultimately improve sleep quality over time. That's a really great technique.
So it sounds like some of it is eventually about getting into that optimal sleep scheduling for folks, but it also sounds like some of it maybe not being in your bed to eat or not being in your bed to watch movies, really being thoughtful about that, like time in bed versus time in bed in non-sleep activities.
Correct. That's exactly right. Yeah. And ideally, when you're not sleeping well, you want to remove all of those activities that are considered wakeful activities, things that you would typically do when you're awake. You want to ideally remove those from your bed and your bedroom until you're sleeping better. Then you can reintroduce things back in. Initially, it is helpful to remove any of that wakefulness or wakeful activities from the bed and the bedroom.
Now, and this is, I think, where we can discern traditional sleep hygiene for maybe what is needed for someone who may be suffering with a sleep disorder or insomnia. I think there's a very that common, like, bed is for sex and sleep. But if someone is struggling with insomnia, would we also say like an active activity, any sort of physical intimacy too, would not be a bed bound activity while they're trying to get into a process of more consolidated sleep periods?
Yeah, it's a great question. So, even with insomnia in the picture, bed is for sleep, bed is for sex, bed is for sickness.
Okay. Those are the caveats. Yeah, got it.
So, perfectly okay to have that intimate time with your partner in bed. It does get a little bit nuanced. Like, if you're wide awake and alert after spending some time with your partner, then best practice would maybe be to get out of bed and then come back to bed once you're feeling sleepy again. So, there's a lot of nuance around the insomnia conversation. But ultimately, whether or not insomnia or chronic sleep struggles are in the picture, bed is for sleep, sex, and sickness, the three S's. Those are perfectly okay and allowed in bed.
Got it. Okay, very helpful. Dr. Silverman, I just learned so much in our conversation today. It's so fantastic to have you on. Can you please share with our audience where they can find you, find more about the work that you're doing?
Yes, thank you so much for having me. I know we covered a lot of ground in such a short period of time, so thank you. I always love to chat about sleep because it doesn't get talked about enough, although I think the conversation is shifting. But I appreciate you having me on and really dedicating this episode to sleep. As far as the work that I do, so I have my own private practice and I see folks virtually in Florida, New York, and SciPact participating states. So I see a wide variety of sleep issues, mostly insomnia, but also see folks with sleep apnea who are maybe struggling with their CPAP machine. I also see a lot of circadian rhythm disorders, and so it can definitely help from more of that non-medication lens. And my website, if you'd like to learn more about my practice, is drsarahsleep.com. I'm also on all social platforms at Dr. Sarah Sleep.
Amazing. All right. Thank you so much for being here.
Thank you for having me.
Thank you for joining our community on the Affirming Minds podcast. If you loved this episode as much as we did, please follow us wherever you listen to your podcasts and share it on your socials. If you want more information about how this podcast can add to your continuing education credits, visit affirmmentalhealth.com. And remember, let's affirm, heal, and grow together.